Well, good morning, everyone. My name is Meredith Call, and I am the Director for Parent and Family Services. I am so excited to see you all joining us today for our webinar about the new student health insurance requirement here at UAB. I've brought in a few experts to share with you some information about this process and how this all works, and as well as the benefits and information about the new UAB health insurance policies that can be purchased. But before we do that, I want to kind of walk you through a few things to know about the webinar and how it works. One, if you do have any questions at any point in time, we will be entertaining those questions towards the end of the presentation, and all you have to do is use the chat widget over at the very bottom of the GoToTraining screen and just type in your question. Please make sure that you do indicate it to be for the entire group to be able to see, but we will be able to entertain your questions towards the end. Please also make sure that you have muted your speakers just to ensure that the sound quality you don't get any reverb or anything along those lines as we go through the presentation. But please let us know as we go what questions and things you have so that we can make sure to address them all at the end of the presentation. But with that being said, the individuals that I've invited to share with us today about our student health insurance requirement is Jake Baggett. He is our Assistant Vice President for Student Health and Wellbeing here on campus, and then also Carol Briggs, who is our Practice Manager within Student Health Services. So I'm going to turn it over to these two experts to share with you about this new policy and requirement here at UAB.
Good morning. Again, my name is Jake Baggett. It's a pleasure to be here with you this morning. Appreciate you taking the time to discuss and learn about the UAB Student Insurance Program. So we're going to go through real quickly just an overview about the requirement itself. We'll spend some time talking about the health insurance plan that UAB offers, and then we'll spend some time talking about waivers if you have your own coverage and want to waive out of the student health insurance plan. And then we'll leave time at the end for questions that you might have. Based on the material that we're sharing with you. So an overview, one of the things that we need to be sure is that the students that are attending here at UAB have access to health care while they're here to make sure that they are able to continue their academic progress and can seek care when that need requires. It's not actually a new requirement for the university. It's an expanded requirement. All international students and students in clinical programs, both graduate and undergraduate, have long had that requirement. But we have identified that there were a group of students that did not have coverage, and that created some issues along the way. So that's just a real quick historical context of the insurance requirement. Specifically, all undergraduate students that are in degree-seeking programs that are registered for 9 or more credit hours, basically we're trying to address the full-time student, are required to have health insurance coverage while they're enrolled at UAB. Graduate students per program requirements will also have that requirement. And as previously indicated, all of our international students and all of our clinical students in clinical programs also continue to have that same requirement. So the question is, why do students need the coverage? And it may not be immediately obvious, so I just want to take a moment to talk about that. What we do know is that uninsured students are much less likely to seek medical care when they need it, and sometimes putting that off until the condition gets more significant and can create a bigger problem or challenge for them to overcome. And the reason that most often that they speak about that is because they don't have the ability to pay for that coverage. We know that about 1/3 of the patients actually that come to the Student Health Service are self-pay or have no insurance coverage to take care of the costs that they may have. And then we're also seeing an increase in plans that are high deductible plans or network limited plans that create access issues for students as well. We know nationally about 15% of 18 to 25-year-olds in general are uninsured, and 26 to 34-year-old, that number is 18.5%. When ACA was passed several years ago and the extension for dependent coverage extended to age 26, I think there was the assumption that would address the college students' health insurance needs. The reality of it is it didn't really change the number of students who have health insurance on most college campuses for a variety of reasons. We know that medical care is expensive, and as we spoke about before, it can create significant financial barriers. It is often one of the most significant issues leading to financial challenges even after their college experience has been completed. A national survey that we found recently of 2016 indicated that 69% of college students who did not complete a college degree said that would have been helpful if having health insurance would have made a difference in terms of their completing a degree. A very similar percentage of students who actually did complete the degrees shared a similar sort of reporting. So the students themselves, those who were successful, those who just weren't able to complete the degree, all indicate that this is important to their success while they're here. And so the insurance requirement itself, eligible students, based on the criteria we shared earlier, are automatically enrolled in the student health insurance plan prior to the beginning of the semester. However, we know that many, if not most of you, have coverage that your student can bring with them while they're attending here at UAB. And so if you do have coverage, and assuming that it's compliant with ACA, which is basically the university's requirements, you can apply for, your student can apply and waive out of the university-sponsored insurance plan. So for all of you that have insurance, you should be able to waive out of that with little difficulty, and we'll explain that process a little further into the program. So the insurance program itself, we actually have a nationally known and very strong health insurance program through United Healthcare. We actually, if your student is a continuing student, the benefits that we offered last year actually cost about $400 more per year than the premiums that are in place for this coming fall. So annually it's $1,966 a year. That's equivalent to about $164 a month. And I think that those of you who have health insurance or have had to purchase it know that it's very difficult to get anything of any quality that represents that price. The way the premium is going to be applied to students who enroll in the university-sponsored plan is the fall premium will be applied, and then typically the spring and summer applied as one amount to ensure that there's 12 months worth of coverage. And that information will be available on our website as well. So the deductible is very modest, $250 deductible. That's not something you see very often. And the reason why that is so low is that most college students and their families struggle with dealing with those out-of-pocket costs. So the deductible is set in a way that it provides some cost benefit in keeping the premiums down, but doesn't create a bigger barrier for students seeking care. And then the maximum out-of-pocket for an individual plan is $4,000. That's based on the deductible and the co-insurance requirements. It's an 80-20 plan for in-network providers, and the network's very strong here in Birmingham and Alabama and nationally. That's definitely an improvement from our previous coverage that didn't necessarily have a national presence. So this is really important for our students who leave the university for clinical experiences or internships or traveling and so forth. So it's a national network. And it does include, as required for students up to age 19, optometry and dental services, and for all students, psychiatric services, mental health services are provided like any other condition. So it's a comprehensive plan and a very good value if you compare it to what is available elsewhere. So we're going to spend a little time talking about the waivers for those of you who have health insurance and don't want to be enrolled in the student plan.
Hi, my name is Carol Griggs. I'm the practice manager at UAB Student Health Services, and I'm going to talk you through the waiver process just for a second. Many of you already have coverage that meets ACA compliance, and if it meets ACA compliance, it more than likely meets the university's requirement, as the two are very close. And so I'm going to talk you through the process, but do keep in mind that our deadlines, we have two separate deadlines for the waivers. The first deadline is our premier submission deadline, And if you submit a waiver by July 1st, 2018, what that does is it guarantees that the cost of the premium for this semester, for the fall semester, will not be added to the student's account. We strongly encourage families to do this. It just avoids any confusion on the account. But with that being said, our final deadline for the waivers is September the 6th, 2018. And so we will accept waivers up to that point. Okay, so to submit a waiver, there are a few things that you need to know. Your insurance coverage does have to meet the ACA requirements. If you're not familiar with those, they can be found at healthcare.gov /where can I read the Affordable Care Act. And you can get a very quick summary and then also a more in-depth overview of the Affordable Care Act. Your insurance company also has to be licensed within the United States of America. And they also have to provide coverage for the following. For physicians and hospital providers in the state of Alabama, for inpatient and outpatient mental health care, pre-existing conditions. They also must have coverage for unlimited coverage for illness and injury. And then also the coverage has to be active during all semesters of enrollment. The process for submitting a waiver is simple. You go to our website at www.uab.edu/students/health, and you will see an icon on the far left that indicates Patient Portal. Your student simply needs to click on that. And after they click on it, they're going to have to log in with their Blazer ID and their strong password. They'll also have to input their date of birth. And then once they get that, they'll get to this initial page. And the only thing they have to do is click on insurance waivers, and there will be instructions there to walk them through the process. Instructions for submitting a waiver can also be found on our website at www.uab.edu/students/health/insurance waivers. There's a very quick kind of summation of everything that the student will go through in the patient portal to submit it. I strongly recommend that all students submit a copy of their insurance card front and back. And what this does, it allows us to catch any errors, any kind of typographical errors that might occur in the input process. And so once we go through verification, if anything should come back and we need to check that, we simply can do it without having to go back and forth with the student. Once the waiver is submitted and completed, we then send it off for an electronic verification, and the student will receive a notification if the information is not approved. If it is approved, there's no further action required. They will not be enrolled in the student health insurance plan. They will not see a charge for the coverage on their account. Just keep in mind that that coverage will be verified periodically throughout the semester just to ensure that it is active. If that waiver comes back and that insurance information is not approved, then the student will be enrolled in the student health insurance plan. They will get an email from our office indicating that, but they will also have an opportunity to resubmit their waiver if they choose, granted the waiver deadline has not passed. And so that's a very quick overview of the waiver process. It's not very difficult, and if you have any questions pertaining to the waiver process or if your student runs into problems, you can go to our website at uab.edu/students/health, and there's actually an insurance inquiry button on our website, and students can send us a message there if they have problems.
So at this point, we've allowed a significant amount of time to address any questions that might come up, or we can spend time going into some more detail if that's helpful. We try to make the process as simple as possible. And also by going through this process, the student health services will already have all that information on file, so that when your student, if they should need to use the health service for any reason, that won't be an issue. We'll have that information so we can go ahead and deal with those issues at that point.
Okay. Here's one question in there about, first one that came in is about, can you go over again how the premium will be paid, specifically if the student does not enroll in summer classes? So this is going back to specifically purchasing the new UAB health insurance plan.
Right. So the premium, actually, one of the reasons the premier deadline is in place is to allow students and their families who are managing the cost of tuition and so forth to be able to spread that cost over the payment plans available through UAB. That formerly wasn't available, so by doing it by July 1st, you'll get the full benefit of spreading that cost over the fall term. And again, you only have to do this waiver once a year. The spring coverage and summer coverage are billed together as one premium to cover the entire spring and through the summer to ensure that students are covered throughout the summer. That's a requirement of clinical programs, and we just extended that same requirement to students here. If somebody is graduating, we can adjust the premium so that it doesn't extend past their graduation period.
So Jake, just to make sure I'm clear on this, if the first round of premiums would be applied for the fall semester to their student bill, which then would be, since it's applied to their student bill at that point, that means that they can be part of the payment plan, which is the 3 payments that can be made during the month of August, September, and October. And then you would start the process again in January for the spring. And the premium may go up a little bit in the spring because it is a spring-summer coverage cost, correct?
That is correct. Okay. And again, they don't have to do the waiver process except once a year. So if a new student comes in the spring, they would have to go through that process. But for students who continue through the spring, they won't have to do it again until next fall, just to verify their current coverage. There are times that families would lose coverage through employment or aging out of the plan. And in those change of status kinds of situations, we have the ability to enroll a student in the plan at that point. And that's something we deal with some regularity throughout a student's time here.
Well, kind of along those lines, a question just came in is somehow an individual, their student health insurance plan will not go into effect until January of 2019. So they're wondering if they can just possibly purchase the student health insurance plan for just the fall semester.
Yes. So the way that would work is that the student would be enrolled in the student health insurance plan for the fall semester. And once the student has the new coverage, the new waivers will open up for the spring semester around the end of November, and it'll span on to the middle of January. And the student will want to submit a waiver just indicating that they want to waive out of the student health insurance plan at that point. And then the charge will not, as long as they submit that on time, the charge will not be posted to their account for the spring semester.
I'm assuming that information will come to them via email.
Yeah, we will send out communications in a lot of different methods. Students will get notifications in their email. We'll also have that information on our website, and they will also get notification in their patient portal.
All right. One question was then, does the student have to be an active student during the summer, I'm assuming meaning enrolled in classes, in order to have the student health insurance plan coverage?
No, they do not. They just need to be enrolled in the spring. We make the assumption that they're going to continue into the fall, and sometimes things happen and somebody can't, but in most cases that's the case. So we automatically allow them to continue the coverage over the summer term.
And then there was a new question about where can they get a copy of the coverage, the limits and the benefits of the student health insurance plan that UAB has?
That information will be available on our website soon. We're still waiting for finalization with United Healthcare and UAB as a whole. And so once we have that, it will be available on our website. If you go to www.uab.edu/students/health/insurance. And you will be able to get all of that information there.
All right, here's a very excellent question related to the waiver side of things. What is the normal time limit or time period for the waiver to be approved or disapproved, not approved, once it has been submitted?
So right now there's a 2-week turnaround, and the reason that we have a 2-week turnaround is because of the high volume of waivers that we get. We submit them in batches for verification. Typically our time frame would be 1 week. And so from the moment that the student submits it, we would then submit it for verification. We typically do that on a Friday, and we have all that information back on the following Tuesday or Wednesday, and then we contact the students.
And again, if you have insurance, this is only verifying that they're actively enrolled. So that's really the issue that would come up that wouldn't make it a qualification issue itself.
Right, and keep in mind that we only intend to contact students if there's a problem. with their waiver. Most waivers are approved. Again, similar to what Jake said, as long as the insurance is active, most insurance companies, following the ACA guidelines, most insurance companies are in accordance with ACA, and so that's typically not the issue. It's more of a is it activated issue.
We had someone that came in a little late. Do you think you could roll back to the premiums page just to see the cost and the benefits that come along with the premium of the new health insurance plan? Perfect.
Yes. So it's $1,966 for 12 months of coverage, and that's broken down into the fall semester. The premium is $749 for the regular fall semester, and then the spring and summer is a combined premium of $1,217. This is equivalent, I think I said before, to approximately $164 a month. In terms of comparing the value of this coverage to other coverage that you might find on the exchange and so forth. Something I didn't mention earlier is that you may have a question about is the actuarial value. Is this a gold, a platinum, a silver kind of a plan? And for those who have that concern, it's considered a gold plus and might even qualify for platinum coverage. So it's very, very good coverage. Again, most students don't have the ability to deal with a lot of out-of-pocket costs, and that's why this plan, like a lot of student plans, are designed in this manner.
The question came in about their specific health insurance, and so I'm not sure how you want to handle this, but there's a question about whether or not Blue Cross Blue Shield of Alabama would be considered to be a valid insurance coverage if that's what they have through their student.
Yeah. Yes. In short, yes. Blue Cross Blue Shield, I know many of you have sent questions to my office in regards to Blue Cross Blue Shields from other states. And the way that Blue Cross Blue Shield works is the student's coverage, even though it might be Blue Cross Blue Shield of Illinois, it still is applicable here in Alabama because they process all their charges through like a local processing. And so that coverage would be valid.
I'm glad this next question just came in because I think that this will also help clarify. And so this is kind of the other side of the things that you all do, which is there a copay required for doctor's visits? So talking about the student health services side of things.
That's a great question. And one of the nice things about this is that because of the combination of health insurance that they would have through the university-sponsored plan, there are no copays or deductibles that would apply for services provided at the health service. And so that is a real advantage of the student insurance plan that other plans may not extend.
That's the great thing about being a student here at UAB is that they can walk right into or call and set up an appointment or go online and set up an appointment and be able to go in and see a physician or whomever, a healthcare provider to help assist them through.
Yeah. Right. We have a very comprehensive program of services here. If you've had the opportunity to tour the campus, you may have seen that, but we have a full staff of providers, including mental health providers, a very strong counseling program that work hand in hand with the clinical services to address the full spectrum of the needs that the students might have. And in most cases, a student will be able to get scheduled appointment within 24 to 48 hours, depending on the nature of the condition. And we also have a triage ability. So if somebody has a more urgent matter, we can manage walk-ins through that triage process as well.
And actually, Jake, that's a really good point. A couple of things that all of you parents and some students, if you're on, should know is that we also have an on-site lab in radiology. And so when students come in, often the question is, well, there are two questions really. The first question students often have is, you guys don't have appointments and I'm sick, I need to be seen today. And the great thing about our triage process is that your students actually can be seen. Even if they don't see an appointment available, they should still come in and see a triage nurse. Often that triage nurse is going to work collaboratively with our providers that are on site that day, and they will still be able to provide care for your students. So definitely encourage your students to come in. And the second part is that with us having an on-site lab in radiology, often students will come in and they don't fully understand how the cost for labs in radiology work. And so it becomes an educational opportunity for us to kind of talk through students through what that looks like, what that costs. But with that being said, when students come in for lab and radiology, they do not pay anything at the moment of service. We bill it to insurance first, and then after that, whatever is left over, that's what we will contact the student regarding. But when students come in, they don't have to, come in with their debit card on them. They simply come in and we assess the situation, and then we'll deal with any monetary issues afterwards.
Thank you. There's a question in here, couple things. One is, is there a way to see what the dental coverage and the cost for emergency treatment out of state is relating to this policy?
So most major hospitals are going to be within the United Healthcare Network, so it'll be treated as an in-network cost. So if they haven't experienced a deductible yet, the deductible would apply. That's an annual thing like any insurance plan. And then they would have an 80% coverage, so they'd have a 20% responsibility of that bill. And those bills are most often negotiated rates, aren't usually the list price that the insurance provides, so it'd only be 20% of that negotiated rate. And what was the other part of that question? Oh, so dental coverage, yeah. So I don't have the detail here immediately with me, but healthcare reform, ACA, requires that preventive dental services be offered as a part of a plan for students up to the age of 19. That's for all insurances, and UAB's plan complies with that. We also do have a very good opportunity within the student health services for students to get optometry care. We have an optometrist that actually comes into the clinic 1 day a week at this point and sees patients within it. And we refer patients to optometry for services as well as matter of routine, and that again, the optometry clinic is very close by if they can't be seen in the health service itself.
I don't know that we mentioned this one. There was a question, is again, this may have been covered, but when does the coverage itself, if they purchase a student health insurance plan, when does that coverage go into effect?
So for the fall term, the coverage is from August the 15th to December the 31st, and the spring semester is from January the 1st until, well, spring and summer are together, so from January the 1st until August the 14th. Now, if a student, for whatever reason, if they're graduating in the summer, similar to what Jake said earlier, or if they have another situation where they will not be returning to UAB, then of course that summer portion can be altered or edited accordingly. And also, going back to the previous question that was asked about optometry and dental and out-of-state care, very soon we will have a United link on our website that will allow students to log into the United Healthcare portal, and they can actually check on there to see what's in network, what's not in network, what providers they can see in that state, and they can look at all that information for themselves.
One thing I would also add to that is we made sure that all the UAB providers within the Birmingham area are considered in-network providers, and that's more often where your student would seek care. But if they're away from Birmingham, they may go to another provider. And so you can identify all that information. The portal also will include the ability for a student to get a copy of their insurance card.
And their prescription card as well. And for all of you parents that absolutely love EOBs, you also have an opportunity to teach your students how to understand their eligibility of benefits, and also to understand like what's been billed to their insurance, what their insurance carrier covered, and then what they had to pay. It's a great educational opportunity for your students in preparation for adulthood and their own independence.
So while if there's any additional questions, please continue to pull them up, input them. But also, since we've talked about it so many times, why don't we show them the website, since that is clearly that was clearly the way that you can learn and see about all the different insurance requirements and information, and then also obviously that this is going to be where students will be able to go and log in to do the waivers. Once the insurance coverage information is out there, it's all going to be on this page. So I want to make sure that everybody is very familiar and comfortable with going to the UAB/students/health page.
All right, so this is our website homepage, and again, if your student wants to submit an insurance waiver, they can do it right here in the patient portal. And when they click that, they would log in with their Blazer ID and password, and then it would also require their date of birth, and they can get to the waiver. But if you go up here to our Insurance and Waivers tab, once you select it, you will actually be able to get information regarding an overview of the requirement itself. And we have some FAQs, and we will be updating those more extensively within the next 2 weeks. You can also get the insurance on the student health insurance plan, which again, the brochure and all of that information will be available soon. And if you scroll down there, you can actually see some of our previous policies and how the current policy compares to our previous policies. Then you can also take a look at the waiver process, which again is summarized on our website. And everything is hyperlinked, so if you wanted to read through the ACA benefits requirements, you can just by clicking on this link. If you wanted to see a summation of insurance companies that are licensed to conduct business in the United States, you can do that on our website as well. And also, you can actually click here to see a list of all of our providers at Student Health Services. They are all in network with the Student Health Insurance Plan, but this is beneficial for families that will waive out of the Student Health Insurance Plan and they want their students to seek coverage or to seek services at our clinic. It might be good for you to take a look at our provider list just to ensure that our providers are in network for your company. Most of them would be, but just to be on the safe side, it would be good for you to take a look at that.
One of the network limitations that we have dealt with is coverage offered through Aetna is sometimes an issue here in the UAB and the Birmingham community. So if you have Aetna coverage, you can certainly apply for a waiver of the university-sponsored plan, but you may have some difficulty getting an in-network provider.
Are there any additional questions that we have not been able to cover or answer related to health insurance, the waiver process, or anything related to our student health services? Wonderful. Well, if not, we're going to go ahead and close out the webinar. If you do have any questions, their contact information is right here on their on the main page for the student health page.
And you can also, if you have a question that you think of later this evening or after the webinar is over, and you want to submit that, you can actually do that on our website. If you go to our website, there's an insurance inquiry button here. And this page has been actually designed for specific questions related to the student health insurance plan, but you are welcome to put your name, your email address, a phone number, and then just tell us if you want us to contact you via phone or email, and then just type out what your question is, and then someone in our office will be able to respond to you with the answer to your question.
I want to make sure, especially as we're closing out the presentation, to go back one last time and share with everybody, just as a reminder, when the deadline for getting the waivers, or either getting a waiver in, or obviously if you're not getting the waiver, the purchasing of the health insurance plan, when all of those requirement and timelines are, just so that they have a full understanding.
Yeah, so again, the waiver deadline, the premier deadline, is July the 1st, 2018. And the reason that this deadline is so soon is so that students can benefit from spreading the payment of the premium across the 3 Blazer Flex Plan payments. And both those payments are in August, September, and October. There are 3 payments. And so that allows students not to have to pay the entire lump sum for the premium for that semester at one time. And so that is the premier submission deadline. If you submit your waiver after that time, it's still acceptable up till September the 6th. Just keep in mind that after July 1st, you will see the charge for the premium for the fall on the account. Now, it can be removed up to September the 6th, but it makes it easier if you go ahead and submit that waiver ahead of time so that you don't have to worry about having that on the account when you make a payment or anything like that.
So here's a question clarification question for my own self. If they submit the waiver after the premier deadline and the waiver, the charge has been started to be allocated to their account, so they then will automatically be pulled off once the waiver is approved?
Yes. So for the premier submission deadline, yes. If you submit the waiver after July the 1st, the charge is on your account, and let's even say that you make a payment on your account. Once that waiver is submitted before September the 6th, the charge will be removed from the account. So even if you've made a payment, then you should see that go back into your account as a credit. Again, we strongly, strongly, strongly recommend you submit that waiver before July 1st to avoid any of that. But you have until September the 6th to submit your waiver, and the charge will be removed.
Perfect. That's exactly it. Well, if there is no additional questions today, again, please feel free to reach out to either the Office of Parent and Family Services, or if you're going for specific health insurance related questions, please definitely reach out to our representatives from our student health services here on campus. But we are very excited for your students to start classes in the fall, or for returning students to come back and join us again this fall. And I hope you all have a wonderful rest of the day.